So friends, so in the previous part, that is in part one of my talk on the subject heart and the heart diseases, we have studied about the structure of the heart and the functioning of the heart in detail. And we have understood that the function of the heart is to move the living stream of blood through all parts of the body, not stopping even for a single moment. And it consists of two pumps, the left and the right. Both the left and the right sides of the heart have got two chambers each, that is totally four chambers. The left and the right upper chambers, they are called as the auricles, and the left and the right lower chambers of the heart, they are called as the ventricles, so two ventricles and two auricles. And these have got the valves regulating the unidirectional flow of blood so that the pure blood is not allowed to mix with the impure blood. And the heart consists of powerful muscle fibers that have the power to contract or beat rhythmically. The motions of the heart are maintained by a specially designed structure. Pure blood is carried from left side of the heart through aorta and its branches. The branches are the left and the right coronary arteries. And these arteries again divide themselves into smaller arteries, then into small capillaries which carry the oxygen and the food to the tissues. The impure blood and the carbon dioxide are picked up by smaller veins, forming and they form larger vessels on the way back to the heart, to the right side of the heart. Finally, through largest veins, namely the superior vena cava and the inferior vena cava. Impure blood flowing from the right hand side of the heart. After its purification in the lungs, it passes through the large pulmonary veins to the left auricle when the mitral valve opens and it passes into the right ventricle and immediately pumped through aorta and its branches to the entire body. Here again, I want to clarify that I am not a medical professional. Please suggest if any minor mistakes have crept in, especially in the pronunciation of the medical terms, and I welcome your suggestions with an open mind. So whatever we studied in detail, I have summarized here in brief. So now we will see what are the major types of heart diseases. So as I said earlier, there are four major types of heart diseases. They are the congenital heart diseases, the rheumatic heart diseases, hypertensive heart diseases, and the coronary artery diseases. See, the congenital heart diseases are less common than other forms of the heart diseases. And it is mainly due to the damaged heart at birth arising due to some infection or injury to the baby's heart during the first 3 or 4 months of after conception. And there are many varieties of the diseases, and no two cases are alike. So there are, mainly the diseases like, of course, the arterial septal defect, the cyanosis, the ventricular septal defect, the subacute bacterial endocarditis, that is SBE, and the patent ductus arteriosus, and the coerection of the aorta, the tetralogy of Fallot. Similarly, the pulmonic stenosis, the rheumatic heart disease, hypertensive heart disease, the coronary heart diseases, and also fainting, dizziness, palpitation, sinus, tachycardia, the fibration, heart block, heart failure, etc., etc. Anyway, now in this part, we will only concentrate on the first part. So what I said, the congenital heart diseases, that is diseases coming from the baby stage. So in that, the first one is the arterial septal defect. So this is an abnormal This defect itself is an abnormal opening between the two upper chambers, that is between two auricles, left and right auricle. So instead of flowing in the normal direction, some part of the blood flows from left auricle to the right auricle. So that is even the pure blood, it flows back into the right where the impure blood is present, and it is recirculated through the lungs without nourishing the tissues. So there is an extra workload to the right side of the heart for no good reason. So this raises the BP of the right hand side of the heart. The child often suffers from the frequentest colds and fails to have normal growth because of the extra resistance building up in the blood vessels supplying the blood to the lungs. So again, these are all the cases, the case of children, so which they develop right from the baby stage, from their birth. And second is cyanosis. So this cyanosis, the blood flow may reverse itself from right side to the left side. So when this occurs, the impure blood on the right side joins the pure blood. So the patient may turn blue. So this condition is called the cyanosis. Surgery on the heart is the only solution, and there will be satisfactory recovery if the opening is not too big, if it is not too abnormal. Otherwise, there will be a problem in sitting right that also. And then comes this ventricular septal defect. So it means an abnormal opening between the two ventricles, not auricles, but between the ventricles, that is the pumping chambers. So because of the higher pressure on the left hand side, some of the bright red blood, that is pure blood, it floods into the right side of the heart. So pressure on the right side increases and there is loud murmur heard over the breastbone or what we call the sternum. So here also the lungs are overloaded and the patient may possibly develop a very serious condition called as the SBE, that is subacute bacterial endocarditis. So this defect is again closed by surgical operation by stopping the heart and using the heart lung machine. Then another type of defect or disease is the patent ductus arteriosus. See, there is a blood vessel called as the ductus. So if it has remained open at the birth, it allows the blood to flow from the aorta to the pulmonary artery. So the effects are similar to that of the atrial and ventricular septal defects. Again, the pure blood going and joining the impure blood instead of getting it circulated itself to all these tissues and cells. So continuous murmur is heard here also at the upper left part of the heart, and this defect happens outside the heart. So this also causes extra strain to the heart, to the lungs, and also to the circulation. And this may also cause infection to the heart muscles. So the shunt may flow in the reverse direction, also causing cyanosis. So when the vessels of the lungs become narrowed, that is constricted, and when they refuse to carry the excess blood, so then it causes the cyanosis. So patient may turn blue, especially when he exerts himself, strains himself. He may complain of shortness of breath and pain over the heart. So if the opening is not too large, I mean, few people do manage to live for many years with this condition. But surgery is the best treatment for this condition also, and this should generally be done between the age group of 4 to 10, that is 4 and 10 years of age. Until then, continue with suitable antibiotics. Only then the baby can continue. And then what is called as the Equirection of the aorta, that is localized constriction or narrowing of the aorta at the point where it crosses behind the pulmonary artery. So this means the lower part of the body has got lower blood pressure, BP, than the head and the neck. So blood flow itself is much slower in the legs than the arms. So the child may complain of numbness and weakness in the legs and also severe headache due to very high pressure of bloodstream going to the head. So there is loud murmur again in the chest, which can be heard all over the abdomen, and the X-rays of the ribs, they show, notching along the edges because of the increased size and the twisting of the intercostal arteries. So this is a very serious condition, and it should be treated early. Otherwise, 3 out of 4 patients will die of this defect before attaining the age of 40. So best treatment is to remove the narrowed portion by surgery and using a small graft after bringing the two ends together. So only expert doctors can do this. And then the tetralogy of Fallot. That is due to the malformation or the defect in the septum, allowing the aorta to receive the blood from both the right and the left ventricles. So in addition, there is also stenosis or narrowing of the pulmonary valve and enlargement of the right ventricle. So because of this defect in the septum, both the light and the dark red blood, they intermingle. So the patient is bluish most of the time, and child does not get sufficient supply of oxygen to meet the requirements, and he has to squat down to get his breath after playing, especially after a little exercise. So because of the narrowing of the pulmonary artery, much of the blood passes from right to the left, that is impure to pure. And due to lack of oxygen retardation in the growth, you can see clubbing of the fingers and toes. They also get clubbed, fingers and the toes also. So they die in their early teens unless given the benefit of very good surgery. So the red blood count, it tends to rise from normal, say from 5 lakh to 10 lakh, so about 10 lakh, about 20 lakh, etc. And blood greatly thickens and it slows down the circulation. So a child may have spells of unconsciousness. So a rough and harsh murmur is also usually heard all over the chest. So standard treatment is the construction of the artificial channel between the pulmonary artery and the aorta, or between the pulmonary artery and one of the subsidiary arteries using the suitable plastic material. So then the other important, major disease is the pulmonic stenosis. That is narrowing of the outflow tract from the right ventricle, either at the wall or in the muscle tissue just below that. So it is associated with the atrial septal defect, shortness of breath, harsh murmur all over the chest, and if the narrowing is very marked, the right hand side of the heart may fail. Liver becomes enlarged and tender, legs and ankles may swell and may be cured by surgical operation by using the heart lung machine. And it is associated with the atrial septal defect in this case. Okay, shortness of breath is very, very common in this case. So, friends, in brief, these are the defects that we find in the children if they are born with a defect heart. So this is about part 2, and then part 3 we will see other major heart diseases, especially which we develop later. Not coming from birth. So thank you very much. Good day.